Welcome to Piss Poor Moustaches and Wellbeing. Going to talk about social well-being. So the social determinants of health are massive, huge. Looking at kind of transport, education, access to good food, local education, transport links. So they're the kind of main determinant of factors when we look at kind of social well-being, socioeconomic status. All that plays a huge role when we look at long-term health outcomes. And that includes our obviously health lifespan, so the quality as well as quality of our health. So something to bear in mind, things you can look at is from a social coherence point of view, social actualization and social acceptance, accepting the social circumstances, and that's more important than ever now, given the fact that lockdown and social distancing is huge factors. What I suggest, practical tips, takeaway, think about the other factors that involve that we can change, control the controllables. Main things are looking at what you eat. We've got a nice winter broth going on, nice. Or looking at what we eat, look what we drink, and our sleep are big factors that we can change when we look at behavior change elements, little nudges and little things you can do to kind of help keep you in line with the behavior change side of things, because we can't change much of the social factors. Would be, to my girlfriend's demise, having alarms on my watch, one that wakes me up in the morning, one that reminds me to do my hour of power, meditate, read, and do some exercise. Also one that in the middle of the day reminds me to take a little break, a little breather, catch a 2-3 minute walk, meditate for a couple of minutes. And the other one is just a little bit of a reflective period, so one that's set at like 6 o'clock every evening without fail, so I can stop, pause and reflect on the day, what went well, what didn't go well. And finally, also a bedtime cue. So a lot of people have reminders to get them up in the morning, but they don't have any cue reminder to send them to sleep at night. So much like kids have a wind down time, adults go a million miles an hour, then hit the bed at whatever, 10, 11, whatever time you go to sleep, and they can't wind down because they've been running around cleaning, planning, working. Particularly nowadays when people aren't switching off from the work and working later. So practical key tips: set little alarms or little reminders on your phone or your watch to kind of give you a cue to do some of the behaviors that you want to change. Realize that social determinants of health are massive, huge, particularly when you look at the public health research. We can't control lots of them. Okay, so we need to kind of focus on things we can control: sleep, nutrition, hydration, exercise, and get them right, and you're winning all day long. And have a good evening. That's it. Piss poor moustache. It's ginger too. Fuck. And good well-being.